Now tonight, I'm not going to just talk about youth mental health tonight. I'm going to talk about the whole situation of mental health care in Victoria, which I've been really concerned about probably for about 10 years. And I'm going to show you some pretty disturbing figures. And I'm going to also try and convey an air of optimism as well, because I think we're about to really turn the corner, and I'll explain that a bit more later as well. So now, I'll just start off with a couple of stories. This should be playing automatically. Okay.
The other day, I accepted an invitation from a listener to sit down, have a cup of tea and a bite, and talk about what's happened in his family. He wants to be known by the name of Tony, and he told me a tale across the table that left me very distressed and feeling somewhat, inadequate and useless, I might say. Tony wants his story to be heard by a wider audience, and I'm more than happy to provide the microphone for it. And good morning to you, Tony.
Good morning. Thanks, John, for having me.
Let's start at the beginning. Tell us what happened.
I guess the best place to start would be nearly on 3 years ago now. My wife and I received two distressing calls from two of our older sons.
You have how many children?
4.
Altogether? Yeah.
Altogether. We've lived in our community for over 30 years. Like all parents, we've always wanted to do the right things, and we're very connected in the community, a loving family, grandparents who adored the grandchildren in that respect. But on this particular day, we received two distressing calls separately, one to me, one to my wife, and it was basically screaming coming over the phone, and there was the mention of, he's going to shoot me. I grabbed my wife, we jumped in the car, and we went to this place which happened to be my parents' house, about 10 minutes away. We got there, and as we were rounding the corner, there was over 30 police cars, there was helicopters. It was like a scene out of some sort of movie, and there were the tapes that they put across the road. I disregarded the tapes and I drove through them, and I could see my younger of the two older boys lying on the ground.
He's how old?
At the time, he was approximately 25. As with anything like that, of course, what you're hoping for is to see some kind of movement, because he was just lying there, and so we had no idea whether he was dead, alive, or whatever.
Were there police nearby?
Oh, there was over 24 police.
No, nearby, specifically him on the ground?
Oh, yeah, there were police literally covering the whole street. Mm-hmm. Literally, it was literally like a scene out of some sort of movie. I saw a movement in him which sounds stupid, but it was kind of a relief. At least he was alive, but we still had no indication of what condition he was in.
Were the police attending to him at the time?
The police were standing around. At that point, there was no ambulance. At that point, I jumped out of the car. The police tried to stop me from going to him, but I decided that I would do so anyway. My wife was really distressed, of course, that kind of thing.
Your other son?
My other son, there was no sign of him, but the police that were in the area were standing outside the gate of this particular home, and they had their guns drawn. And so, of course, we were fearing the worst. I guess I summed up the situation by recognising that he had fired the gun, and
so one of your sons had shot one of your other sons.
Correct.
And all of this is because
they'd had an altercation. Both of them had been for some time using ice, and we had tried virtually everything. We had plenty of times we'd had the CAT team around, we'd had police officers around, we'd had smashed up rooms, smashed up house. We had tried everything in our power. We'd been in rehabilitation places, all sorts of things that had gone on, none of which really addressed the issue. with regard to it. And there's plenty that I can say about that particular thing.
So a prosperous family, thoroughly Melbourne middle class,
Yep.
find their world turned upside down because of this particular substance and the grip it's got on your two eldest children.
That's right. And these young men had not had any bad upbringing or anything else like that. I don't think we're terribly bad parents. I think we're average parents. We had always given them the opportunity to speak freely with us and communicate with us.
Good educations and all the rest of it.
Yeah.
So, Tony, I mean, let's avoid some of the issues here, but not avoid others. One of your sons is now in jail. The other one is
Correct.
not. One of them, the one in jail, is no longer using. The one who's out is...
Possibly still.
May still be using.
Yep.
And your frustration, the issues to do with ice use and take-up in our community have been discussed now for years, but
Yes.
your specific frustration is directed at what part of what's going on?
I think it's important to say too, John, that that I'm not saying that what the authorities are doing is wrong. I'm not saying they're being bad or wrong or otherwise. What I'm saying is that the current way that we deal with this doesn't work. It just doesn't work.
Okay, so that's one story, and I just want to say that I've met that father on many occasions since then. I've seen his son in jail, and the son is absolutely 100% recovered now. An incredibly good young man, actually. But that story, and there's more in the interview where the father, by the way, the father's given me his permission to play this tonight, this story tonight, because it's so graphic. When I heard that on the radio, I just stopped the car and just listened to it, and it made me feel very emotional, actually, because I've heard those stories so many times, and and he had to stand in between police and his son on several occasions to protect the son's life. So the son could easily have died. And, you know, we hear this story, you know, I wouldn't say every day, but very, very commonly, increasingly commonly in this state in the last 5 or 10 years. Another story is of a young colleague of ours whose brother has schizophrenia. I saw him actually when he was first diagnosed, and he's now been treated for about 10 years in a very, I would say, threadbare way by a mental health service in the eastern part of Melbourne. Long delays in getting treatment in the first place, languishing for years with severe symptoms just with the GP, and if he gets a little bit more sick, then he ends up in hospital for a few days and then back out again, revolving door. And that was bad enough, but this young colleague of ours told me last year about his sister who was diagnosed with lymphoma. She was in her 20s as well, diagnosed with lymphoma, a form of blood cancer, and treated in exactly the same hospital system. And you would not find better treatment anywhere in the world than that girl received for a physical illness, a life-threatening physical illness, just like schizophrenia is a life-threatening mental illness. And the family were just completely gobsmacked with the contrast in care. It's like a form of apartheid, actually, the difference in access and quality that you see in the treatment of mental illness in the same mainstream hospital system. I'm going to come back to mainstreaming in a minute. And I could go on and on about stories of people let go from emergency departments who have died within days, you know, probably at least over 100 people in that situation in Victoria each year. I'll come back to the figures later. So the stories just are piling up. So what is a mental breakdown? Well, a mental breakdown is an acute, time-limited mental disorder that manifests primarily as a severe stress-induced depression, anxiety or dissociation in a previously functional individual to the extent that they are no longer able to function on a day-to-day basis until the disorder is resolved. They don't happen overnight. Human beings are intrinsically resilient, and it usually takes multiple forces operating over a sustained period to overwhelm us with emotional pain and compromise our ability to function. There are nearly always warning signs. They don't happen overnight, and these are usually ignored or often ignored. So can a state system, can a mental health system have a breakdown? Well, we often hear claims about the system being broken, don't we? Or that there's no system. And I think we've been warning now, not just me, but many other people in the mental health field in Victoria, been warning for over a decade that we've been drifting and accelerating towards a breakdown. We've written quite a number of opinion pieces in the paper, interviewed on John Fain and many other sort of outlets, trying to get the governments to listen. Both sides of politics responsible here. And I'm not talking about this to blame anyone, actually. I think you'll see why this has happened. It's no individual person or even political party is actually to blame here. I think, I'm optimistic because I think the present Victorian government has late last year acknowledged this disastrous sort of situation, this crisis, and that it's reached a point of breakdown. And I really believe they're shaping to do something serious to fix it. How serious? That's actually the big question for the next 12 months. So this picture here is the pessimism that was kind of ingrained in mental health care when I first started working as a trainee psychiatrist. There's a picture from the 19th century, actually, which is where all our thinking about mental illness was sitting until about maybe 20 years ago, really. In 19th century thinking about incurability, out of sight, out of mind, all that kind of stuff. And this is the mental hospital I trained in Newcastle, Newcastle Psychiatric Centre. And this is the Royal Park Hospital, which is now closed, when I first came to Victoria 30 years ago. It's where I worked, and that's our inpatient unit there. And that's our special inpatient unit where all of our youth mental health work originated from, actually, from that inpatient unit with young people with a first episode of psychotic illness like schizophrenia. So that's the sort of setting that we were starting off from, a very low base, pessimism, no hope, very, very demoralising. Around the time I came to Victoria, about actually the year before, in 1983, this paper was published in the Australian and New Zealand Journal of Psychiatry by George Lipton, who was then the State Director of Mental Health. And he was talking about the politics of mental health and, does it just go round in circles, or could we actually spiral out of this and get to a better place? And he talked, it's actually an incredibly wise paper, with analysing all the issues that we're still grappling with, but in a very pessimistic way. And he would have been pessimistic to see actually what has happened since. But just a couple of quotes from there. So he says, the politician is severely constrained by the attitudes of his constituency, and he leads or lags at his peril. Well, I think we've still got that problem with politicians, not just on mental health, but he has two major tools which enable him to pursue philosophies that are at variance with public demand. The first is to convince the public that some policy or other will rebound to their personal advantage. This often has severe cost implications, and that's definitely true of mental health care. That is absolutely true. The cost implications are very significant for this state government. The second is the vehicle of public fear or guilt. This leads to law and order issues, as you just heard from that story, to increasing regulation and occasionally to improvement of services to the disadvantage when it's become a public scandal. And we've had many other examples of untreated mental illness leading to public tragedies even in the last 12 months in Victoria. Another quote, how can a politician effectively give priorities to an area whose problematic status is denied by his own constituency? Now, certainly in the 1980s, that was definitely the case. The public did not want to hear about mental illness, not at all. You might think they do want to hear a bit more about it now, and I'll come back to that, but I guess you're all here because things have improved a bit. Still, can he afford to confront them with their denial? We might be really great at talking about mindfulness and having the conversation about mental illness and being aware of depression, but are we willing to talk about more serious forms of mental illness? Can he dare to overly expose the community's guilt and the resentment that this inevitably brings? So this is why it's much more challenging than cancer or heart disease. What we're talking about here it's more complex. There's more. Every person has got issues with it. Mentally ill people are difficult to be with quite often, and it's a challenge. I think that's one of the things we always underestimate. So those institutions, as you probably know, were swept away in the 1990s, and there's a paper by Val Durand describing that process, and it happened during the Kennett government. Notice that Jeff Kennett actually opened this theaterette, and I think we can analyse his legacy a bit later on. But you do get the sense even now that the mental health, mental illness it's an awakening giant. This was a cartoon from The Age a couple of years ago, and it's incredibly important to our society, and it is starting to wake up, you could say. And as we've had Beyond Blue, lots of awareness. We've had Are You OK Day, and in 2010 it was probably the top or third top Australian issue. You had the economy, you had climate change, and then you had mental health in terms of what the Australian public thought was important. And the ABC helped us to raise money for mental health research 2 years in a row. That was fantastic. The whole of Mental Health Week, they had programs on mental health. But they still talked about having the conversation. And the problem is that none of these kind of changes in sort of atmosphere have led to improvement in investment in mental health care, which we all assumed that if you had better knowledge, better public education, that would be the stepping stone to then people supporting governments or encouraging governments to invest. But that absolutely has not happened. And, that's led Helen Razor, who gave me and the ABC a pretty hard time about mental as, because she said, it's a complete waste of space. What are you doing? Awareness is just a distraction, actually. It's actually taking the pressure off. It's making the politicians think that something's being done, just because people are talking about it. So I hadn't thought about that before, and at first I was a bit defensive, but then I actually talked to her and I could see what she was actually saying. And we're not knocking Beyond Blue. They do a lot of great work, but it's this idea that somehow having the conversation is enough. And again, not knocking Are You OK Day, it is the first step, but what if there's nothing beyond that? And in America, there is nothing beyond that. This is a book by Fuller Torrey, who's been one of the complete leaders of schizophrenia research and serious mental illness research in the US with the Stanley Foundation. And he's written a book describing what happened in America from the early 1960s through to now. And basically, the federal government decided to invest in community mental health centres, but the intention wasn't to look after people really with mental illness. It was to do something preventive, psychoanalytically based, vague, non-evidence-based, sort of over-promising that they could actually prevent mental illness through this this program. So what happened was they closed all the services, all the old hospitals, and they excluded those patients with mental illness from these centres. And gradually, the state governments there just completely stepped aside from providing care to the mentally ill, and the federal government really didn't do anything effective in its place. They spend quite a lot of money in many ways on mental health care, but the vast majority of people can't access it, and it's incredibly sort of limited. So he describes all the consequences of that in the book. You can see the subtitle, how the federal government destroyed the mental illness treatment system. And if you've ever been to America, you have to step over homeless people, along the pavement, wherever you go in the big cities. The jails, the prisons are full of mentally ill people, and there are homicides and suicides directly attributable to untreated mental illness every single day in large numbers. So it's an absolute war zone, you could say, in terms of what they've created. They should be thoroughly ashamed of themselves. They hold themselves out to be the leaders of international sort of psychiatry with their DSMs and all these other sort of things, and their country is a joke when it comes to the treatment of the mentally ill. And we are catching that disease. We're catching that problem, and I'll show you the figures in a minute. It's another book along the same lines, the consequences of the kind of moving into the shallow end of the pool without sort of hanging on to the deep end. I'm not saying that our headspace reform is totally about having a soft entry for anyone who's even got a mild problem. That's absolutely their right with primary care, but we've got to actually make sure the whole spectrum is looked after, and these countries, the US has not done that. So here are some of the pictures. Some of them are American, some of them are Australian, actually, these pictures. And it's probably getting worse. Well, it is getting worse here too. And in Australia too, there are many more mentally ill people in beds in prisons than there are in hospitals, and it's increasing. And Tony's son, the father, in that interview is one of them. And it actually took him being admitted to jail, being incarcerated in prison, to get effective treatment for his mental illness and drug and alcohol problems, of which he had both. It wasn't just an ice thing, it was a combination of ice use in the self-medication way with poorly treated mental illness. So, and this is in the Herald Sun earlier this year. It's a story, sort of, we don't like to talk about this in mental health, but while the vast majority of people with mental illness are safer than the general population and are much less likely to be involved in violent or criminal activity, there is a subset, if they're not treated, like Tony's son, who will end up in conflict with the law and will be dangerous in that situation, as you just saw, where someone got shot. And if he'd been treated, there's no way that would have happened. We know that 60% of murders that are committed by psychotic patients, and they're by far the tiny minority of murders, by the way. The vast majority of murders are committed by people without mental illness. But of the ones that are, the small number, 60% of them are committed by people who have never been treated. So it takes a violent incident to actually bring the person to attention. And these are preventable deaths. So obviously it's not great to have the Herald Sun with these sort of headlines, but community safety is an issue here. In Origin, we never saw any murders committed by young people in our region for probably 20 years. I can't remember a single one. But as we've been overwhelmed by population growth and cuts to services, several years ago, we've now seen probably 5 or 6 people who have been untreated or poorly treated and have actually killed people. So this is something we've really got to be honest about as well, while not stigmatising the vast majority of people who wouldn't even ever be anywhere near that. Okay, so this is still part of the whinge part of the lecture. So this is another quote from a paper in the mid-70s. And obviously, what happened in the 90s was we got mainstreamed into acute health care. So all the beds got moved into general hospitals, and we got managed by places like the Royal Melbourne, by the way, also founded by Sir Redmond Barry. And so that mainstreaming, seemed like a good idea, but it really hasn't worked that well. We've been done over, really, by having been mainstreamed into the powerful teaching in acute hospitals. And that's why I think that phrase, the battered child of medicine, is very, very apt, having worked in that system for the last 20 years or so. As we look back, we view the battering that psychiatry has taken as the price of painful acceptance of the young child and the family of medicine. But we also see that even in its youth, psychiatry has brought about a revolution of thinking, feeling and behaviour of the family of medicine as a whole, and in doing so has profoundly affected the collective consciousness of society regarding its mentally ill. Well, that's the upside. You might think that is the case, and it is to an extent, but we have really suffered through this mainstreaming, and I'll show you why in a minute. So this is just an example of just one of the many op-eds that we've written over the years about this problem. It's a national problem. It's not just a Victorian problem. The problem with Victoria is that it was the actual jewel in the crown nationally of mental health care. I'll show you some figures on that. But we've slipped badly. But all the other states are equally problematic. That's the MJA editorial. And this is WA, so it's not just to show that Victoria isn't the only one. The AMA magazine in Western Australia is actually showing it's the broken state, and it's all about the mental health services in Western Australia too. So it's a national pattern. It's the same pattern that happened in the US, but not as bad, but it's in the same heading in the same direction from the state government point of view. So this is the experience that we feel. This is a Scandinavian slide, actually, but this is us, the mental health workers down here on the right, and we're coming on the scene late, and people have been badly hurt by the time we come in contact with them, like Tony's son, and there's not much of a safety net. This is part of our argument for early intervention and for youth mental health, to build up the system at the front end, which I'll come back to too. So now, the cavalry arrived last year. I think that the Andrews government, to be fair, when they took office, they recognised that there was an issue, and it had been a long time coming, probably at least 15 years. So again, both sides of politics responsible. But Stephen Duckett was doing an inquiry into the obstetric deaths out in Bacchus Marsh, and fortunately, and I think he deserves the credit for this, he argued that we should have a look at mental health in terms of safety, in terms of the health system, because anecdotally people were very aware about all these preventable deaths from suicide. That's probably much more numerically important. Got friends that work in the EDs around the city, and they're traumatised. Every couple of days there'll be someone that they've seen in the ED and sent home, and the person will be dead. And that was becoming a thing. And so I think Stephen Duckett then thought, let's have a look at it. He did. And the department, I think, supported him in this. I think the Department of Health now has some really great leadership and is really looking seriously at these issues. The department has also failed to act on red flags, signalling more systemic problems in care. Nowhere has this been more apparent than in mental health care. Significant degradation in funding relative to needs in quality and safety has occurred over the past decade and has not been acted upon, he says, by the department, but it's really the ministers and the government at the time that were responsible for this. I think we can't blame the people in the health department. A strengthened focus on improving care and mental health will be insufficient. However, when the overwhelming threat to safety and quality of care in mental health is the significant and rising pressure on services, this will need to be addressed through funding. So we've had, 500,000 people come into Victoria in the last 6 years. So just massive population growth, especially where we work in the northwest of Melbourne and the southeast of Melbourne. And growth corridors are just, and we're just getting overwhelmed in these frontline services. Okay, so I think here's some figures of what's actually happened in Victoria. If you look at the spending, it looks like it's gone up, but that's not in real terms, and it's certainly not in proportion to population increase. In real terms, there has been a serious cut or a failure to keep pace. If we put up the figures for general health care, now you might think general health care in the hospital system's under pressure too, and it probably is, but it has increased much more rapidly than what we're seeing here, so much so that nationally, we're down to about 5% of the total health budget in Australia is spent on mental health. It's 14% of the burden of disease, so huge mismatch here. But the interesting thing is that Victoria has gone from being, the highest per capita spender 20 years ago, over 20 years ago, to the lowest. And I'll show you a more accurate. So this shows it more accurately. The national average, about 2% of the population in any 2% of the population are covered by state-funded mental health services nationally. Now we know that the convention is that 3% of the public suffer at any given time from a serious mental illness. So 2% you could say is not too bad. It's still only 2/3 of people being covered at all. But in Victoria, we've slipped down nearly to 1%. So it's about half the level of the national average. And you can see some states and territories are doing, extremely well, like ACT and Northern Territory, surprisingly. But Victoria used to be, as I say, the jewel in the crown. We used to have hundreds of visitors coming from all around the world all year to visit the state-of-the-art community mental health system that was built in the late 90s. Used to come to visit our early intervention services for psychosis, and they still come to visit our youth mental health reforms services, but they're not coming anymore to look at our community mental health because it doesn't exist. It's been dismantled. if you look at the beds in blue, the number of beds in Victoria are below, well below New South Wales and probably on a par with Queensland. So we don't have enough beds, but that's not the main problem, actually. The main problem is the community. Now, this is emergency department presentations. As the assertive community treatment and the systems have been shrinking in real terms, we've seen this rise. I think it's 42% over the last 6 years in emergency department presentations. So that's why everyone's ending up in the ED, because there's no other option. And the CAT teams, such as they remain, are overwhelmed and don't do what they once did. Yeah, and it's particularly an issue for young people and people in the prime years of life. It's their main problem. It's their main health problem. Mental health is the main problem of people in the prime years of life. You can see in older people and little kids, mental health problems are not the main problem that's driving them into the emergency department. So, and emergency departments are incredibly poorly equipped to deal with it. Their mindset, their whole, battle plan is about responding to car accidents and heart attacks and that kind of stuff. They're not calm, relaxed, therapeutic type people. They can't really do it. It's not their fault. And even when you put mental health people in there, it doesn't really work either that well, despite the best efforts of the people that are doing it. I'm not criticising the staff. It's just a bad model. It should be reserved for absolutely extreme situations, not the first port of call. And the police shouldn't be the first port of call either, as you can see from that story. Neither should the ambulance service. It should be mental health people. There should be a really strong, proactive mental health system with experts, and in that front line. Okay, so now here is probably the key slide, which is our community contacts, the amount of community activity that's happening, and it's the worst. It's a disgrace. We were the best, and now we're the worst in terms of the support and funding. Also, the waiting times for people with mental illness have gone up. The severity of the presentations have increased. All of this is in the Australian Institute of Health and Welfare data. And the amount of time that people spend with these people when they present is shorter as well. So everything is under massive stress. So it's no wonder that there are so many preventable deaths. And this is where we need to go. We need to catch up with these other jurisdictions. And we've got to do it fast. I think the health department's modelling might be thinking, well, it took 10 years, 20 years to get like this, so we can't really fix it in 10 or 20, it's going to take 10 or 20 years to really fix it up. Well, no. We have to work much more rapidly, and we have to invest very, very heavily to fix this. And that's going to involve, obviously, creating new workforces as quickly as we can as well, and scaling it up. We can't do it overnight, but we're not going to take 10 years. We've got a 10-year mental health plan. That's a joke. 10-year mental health plan won't even have the same government in 10 years. So we should be planning for reasonable timeframes, like 3 to 4 years with these sort of things. So, we call this the missing middle. So what we have, and Frank Quinlan from Mental Health Australia presented this to Greg Hunt last Thursday when we had a big roundtable, and he showed figures. There's quite a lot of activity at primary care level in general practice, and then there's all this activity at the bottom of the cliff in the emergency department and the police and everything. But in the middle, expert specialist multidisciplinary care is in incredibly short supply. It's like a tiny little piece on the graph. Everything else is much bigger. So we call it the missing middle. And in Headspace, we can get lots more young people into the bottom step on the ladder through Headspace, which is fantastic there. And then we can treat a lot of problems in Headspace, but there's about a third of those young people that need more complex care, and there's nowhere for them to go. I'll show you in a minute. We're turning 3 out of 4 of these young people away from Origin, which is designed to look after those more complex patients. So these are the missing steps. The National Mental Health Commission in 2015 said we have to bring in stepped care for mental health care across all age groups. But the trouble is, there's a bottom rung, there's a bottom step, and there's a top step, but there's nothing much in the middle. And anyone, whatever age you are, if you've tried to seek mental health care in the community to see an expert or see an expert team, you almost have to invent your own team. And it's very, very hard to find the people. Even a city as big as Melbourne with lots of psychiatrists, it's very badly designed, badly organised, and financial barriers exist as well. So those steps are just not in place. Now, luckily, apart from some new leadership in the health department and a state government that's at least acknowledged the problem and shaping to do something about it, we do have some other friends and allies who are going to help us, and that's the economists. And this is the reason. And now, in the hard world of economics, if you were going to invest in non-communicable disease on a logical cost-effectiveness basis, you wouldn't be putting all the money into cancer. We're putting a fortune into cancer in this country. And we're getting a few more months of life expectancy at the end for huge investments. I'm not saying we shouldn't do it, because that's a value judgment the community will always make. And if I get cancer, I really hope that there's really great treatment available. So I'm not knocking it, but look at what's happening with mental illness. It's incredibly underfunded, and yet it has a massive effect on the economy. So if you start treating people in the prime of life, young people and people going through those productive decades of life much more effectively, because only a minority of them get any kind of evidence-based treatment at the moment, even in rich countries. If you did that, it would pay for itself many times over because of the economic benefits that would flow from it. We know that. We've done that with psychosis, and we've done the cost-effectiveness studies. If we extend that to the other range of mental illness, we'll see it there too. So it's just like a form of self-harm by the country not to actually do this. And it doesn't have to be at the expense of cancer or heart disease. We just have to catch up and do the same things that they do: prevention, early intervention, sustained treatment, and looking after people who've got more long-term conditions properly. That's what they do in those areas. They do that mostly. And here's some other data from my colleague Owen Kalaki. Showing that the biggest growth in the disability supports pension is people with mental illness. That's one of the drivers of these costs. And once you get onto that DSP, there's only two ways out of it. One is dying, and the other is the old age pension. You're not going to go anywhere once you get on that DSP. So it's like a death sentence for our young people if they don't actually recover and they end up in that. Not to say they shouldn't be supported financially, but we do everything we can to get them back to work, back to education, back to school. And if you look at the amount of money in the national economy that's being spent on mental illness, a big chunk of it is on the cost of failure to treat effectively. Welfare costs, prison costs, a whole range of costs increasingly. So we're spending money that we're actually wasting money by not actually spending it in the right places. And this is where this term mental wealth comes from this paper. You've probably heard Malcolm Turnbull using this term mental wealth because Ian Hickey inserted it into his brain, and he says it quite often now. But basically it means that the build-up of social capital across the lifespan. So if you have a small child, have a baby, and you bring that child up, you know how much it costs financially and emotionally to bring that young person to the threshold of adult life. And if they break down, if they have mental health problems which maybe risk putting them on welfare or possibly dying even from suicide, or obviously that's the most tragic and terrible outcome. But even if they underachieve, even if they don't fulfil their potential, then there's a loss of social capital which extends across decades. And that led to the World Bank to sort of value the life of a 22-year-old most highly across the whole lifespan, which is sort of what this diagram actually shows too, that it's the worst thing to happen. If you've done all that and the person doesn't actually become productive in society, become self-sufficient, and leads a fulfilling life. So mental illness is quite different from physical illness in many ways, but especially, and we've kind of shoehorned it, we've tried to shoehorn it into our clunky, acute system of both general practice and acute hospitals. But the one thing we didn't do when we were doing that in the 90s was look at the pattern of onset of these illnesses. So it's the mirror image of what you see in physical illness. In physical illness, it's in younger children and it's in the over 50s, pretty much. In the middle years of life, adolescence and middle years, we've never been physically healthier than we are now. We don't need big hospitals for that stage of life. We don't need all those things. But we've actually forced mental health into the same sort of age ranges, and we've underinvested, particularly in that surge in adolescents and emerging adults, peaking in the early 20s. The system's weakest where it should be strongest. And we've tried to do something about that with some support from government in recent years. And that means building a system of care for emerging adults, basically, teenagers and young adults, which is where all the action is. You can see that surge of morbidity there in that age group. So Australia has actually done a great thing by innovating around that in terms of reform for youth mental health. But it's still base camp. We're still nowhere near where we need to be. And part of the argument is about how young people develop. It's not a one-size-fits-all. They don't suddenly become adults at 18. It's a transition, and it's particularly a transition that's affected by having mental health problems, and slows things down, makes it much more challenging to make that developmental transition to being an adult. So early intervention, Headspace, models like Headspace were backed up by models like Origin, more specialised, complex care are what we need. It's a process. This sort of reform process, so starting at the top, that's the Governor, former Governor General visiting us a few years ago. We've got a collection of Prime Ministers. We have to keep updating this collection, but they've all been out to visit us out in sunshine in the western suburbs of Melbourne. And Greg Hunt, we had a meeting with him last week, as I said. See where his hand is? He actually does care about mental illness. His mother had bipolar disorder. He's the first health minister that we've ever met who actually really gets what it's really like living with a serious mental illness. And, the Victorian government, as I say, has commissioned a report, which has, been leaked about 100 times by now. And so we know what they think, and we know the facts. What we don't know yet is what they're really going to do about it. But the signs are good. They've got some really serious experts in the health department that have been recruited in to work on it, and hopefully we'll be able to influence it too. So, what are the things we have to do? What are the pillars of investment? The first one, at absolutely top of the list, is rebuilding this, underinvestment in community mental health. I didn't put any numbers on this because I didn't want to frighten any government people that might be in the audience, but we have to go, broadly speaking, from an annual budget of about 1.1 billion a year, which is spent currently on mental illness in Victoria, to a budget of about 2 billion. And we need to do it in the next 5 years or so. We've got to build it up in a stepwise way. So we're talking about hundreds of millions of dollars extra to fix this problem. And that will bring us up to a level where we're covering closer to the full number of people with serious mental illness that need expert care. It still won't get us there. And there will be many savings arising from doing that, actually. So it's not going to, in the end, going to cost the community that much. But if we can find billions of dollars for children's hospitals and cancer centres and new freeways, this is an investment in the fabric of Victoria, the human fabric, and we have to do it. I'll just show the next pillar is the youth mental health system, and that has to be an absolute centrepiece as well. We have building blocks here in Victoria, but look how weak they are. We cover 1 million people in the west of Melbourne, and we get 4,000 complex referrals into our front end at Origin, which links to the 4 headspaces that we run. These are people who seriously need expert multidisciplinary care. We're turning 3 out of 4 of them away, and they're dying in bigger numbers. This is something that makes me absolutely furious when I hear of a death every few weeks. A person that should have been, they don't have terminal illnesses. In a few weeks they'd be better and they'd be alive, and they die unnecessarily. This is happening. So it's worse than turning away 2 out of 3. We're turning away 3 out of 4. And the final thing, actually I should say what we need to do there. First of all, the state government has, an incredibly positive move for us, and we're very grateful for this. They're rebuilding our facility, our research/clinical facility at Parkville. So there's an opportunity for, a statewide reform built around that new facility. And we would like to see much stronger mental health services across not just the northwest, but also the eastern area and the southeastern area, especially in these growth corridors. And that can be done, and that should be between 12 and 25, strengthening the system, so right in that peak zone. And that will take the pressure off the rest of the adult system too. So that is something that we've been working on for 10 years, and it just hasn't really been nailed. It hasn't really been properly funded. So that we really want to see that. And the final thing is mental health research. I mean, mental health research is incredibly poorly funded in this country. The Minister today, Greg Hunt, announced some improvements to that, which are very welcome. But if you look at what the state government is putting into research, apart from this new facility, it's really much less than what you see in the rest of medical research. So a fair deal there too. And this is the situation nationally where, even though it's the major cause of burden of disease in the prime of life, it's funded much less than cancer and cardiovascular research. Same pattern as within the service system. And in the UK, and it's probably the same here, if you look at the corporate and philanthropic sectors, for every pound spent by the government on mental health research, the general public donates only 0.3 of a pence, whereas for cancer they donate £2.75. So the situation's worse in the corporate philanthropic public domain than it is for the government. We're getting a raw deal from the government, but getting a very raw deal from the community in terms of support for mental health research. And where are the new treatments going to come from? Where are the improvements? Where's the new knowledge? Where's the prevention going to come from if the research is not supported? So that's another thing. So I do want to acknowledge what the state government has done for us. And I also want to acknowledge Lynn Koski and Jim Williamson, who's in the audience tonight, for the tremendous effort they put in to help us get to that point when the government was coming in. And they've honoured that pledge. The building is being built. So this is a huge opportunity for us to really revive ourselves and move forward and really deliver, especially in the youth mental health area. But we want to see it happen across the lifespan because we care about all of the Victorians with mental illness. So that's what the new facility is going to look like. It's as well as the functionality, it's like a statement. It's like saying mental health, mental illness is as important as cancer and heart disease. If you have a state-of-the-art sort of facility like this, it's incredibly important for the patients, for their families, and for us as people in mental health. We suffer from what's called structural stigma. Not just the patients are stigmatised and the families, but we are for working with them. And within medical research, all these areas, we're underfunded because of this structural stigma. That's an antidote to stigma when you do something like that. So we're very grateful to the Premier. The other side of the coin, we talked about the Prime Ministers and the health ministers and all of that. They're dependent, like George Lipton pointed out, on the public. The public has been too passive, way too passive on this. We managed to mobilise 800 people going back 13 years, which really was the kind of groundswell that got Headspace funded, that kind of activism that was happening then. And in other countries, they're starting to do that. This is in Ireland. There's a mental health reform movement there. Grassroots activism is what we need. Probably at this level, I think. This is in Poland, actually. We managed to get rid of the Iron Curtain, so surely we can do that for mental health. And so we have been working, a group of people, including me, who've got lived experience of mental illness in their families or personally. And this is a small group, and Lisa Sweeney, I'll mention her, she's here tonight too. She's been a great force getting this off the ground. We set up something called Australians for Mental Health. We want to raise a lot of money to support this campaign. It's going to be a standing campaign. It's going to move from one state to the other, campaign for a fair deal for people with mental illness, and it's going to campaign in federal elections as well, using the Get Up sort of model, but focused on this issue with a bipartisan target. So that's the missing ingredient, that we haven't done that yet, and we need to do it. It'll help the politicians, it'll help the genuine politicians that do want to do something positive. And I think Martin Foley, the current minister, I think he genuinely wants to address this, but he needs us to create the environment where enough money will be freed up to do it. So I'm going to stop. I thought I had a picture. Oh, there's one slide which I had a thank you slide actually. I just wanted to thank everyone affected by mental illness who's shared their stories and helped us to get this issue on the agenda. I want to thank all my colleagues. I want to thank the State Library. I want to thank the politicians that do support us and both sides of politics. I mentioned Jim. I want to thank Jim. He gave me lots of really good advice for the lecture, including one thing I forgot, which was we spend about $23 million at Origin on the western suburbs of Melbourne for 1 million people, and 50,000 young people with mental illness live there, and we treat about 1,000 a year. A high school, I think he showed me the budget for Glen Waverley High School in the eastern suburbs is about 23 million as well. One high school, and that's all we've got for the whole mental health problem in the whole of western suburbs. We need to treble that if we're serious. That's the sort of scale that we're looking at. And I think, thank you, Jim, for that very good, a good comparison. We're looking for that. We spend 22 billion a year now on the NDIS for 400,000 Australians. We spend 8.5 billion a year for the 4 million Australians with mental illness. So you can see the mismatch, and those are the sort of figures we've got to turn around, and we'll be hoping that our government and with an election year, we're looking for a bit of a bidding war between the two parties in terms of who's going to fix it. So I'll stop there. Thanks very much. Sorry I went on too long.